Hello, thank you for joining the Exceptional Family Member Program at Lejeune-New River for this brief presentation on Supplemental Security Income and Medicaid. Should you have any questions throughout this presentation, please feel free to type away and ask. However, I will want to highlight that if you ask a question that is really unique and specific to your family, we don't want to engage in that conversation online. We may refer you to contact our office tomorrow, or I'll have somebody reach out to you tomorrow. So please, again, feel free to ask questions and we'll answer them. I have some people standing by to take care of that for you. So what we're going to cover as our learning objectives for this presentation are listed here. We're going to understand what exactly Medicaid and SSI are. We're going to highlight and identify the eligibility requirements for each. We'll review what each covers, so what type of coverage you'll get with each one of these programs, and recognize and identify resources that are available to you. All right, now that we've covered the learning objectives for this presentation, with me I have the attorney for Exceptional Family Members for Marine Corps Installations East, Miss Vicki O'Brien. I'm going to hand the mic over to her and she's going to take it away.
Thanks, Patrick. So what is Medicaid? In a nutshell, it's a joint federal and state government program that helps low-income and low-asset individuals, as well as seniors and children and people with disabilities, pay for some or all of their health care bills. It covers medical care like doctor visits and hospital costs, long-term care services in nursing homes, and long-term care services provided at home as well, and visiting nurses and assistance with personal care. Who would be eligible for Medicaid? Well, as you know, there are income requirements, and in the state of North Carolina, if a person who is disabled applies for SSI and they are found eligible for SSI, North Carolina is an automatic state, is what I call that. The person with a disability becomes automatically eligible for Medicaid in our state, and Social Security will then contact your local Medicaid office and make sure that enrollment happens and things are taken care of from there. Because it's a federal and state government program, it's basically federal dollars that are administered at the state level, and whatever states spend as far as money, the federal government matches those funds. So there are certain services that are required under federal law to be covered. But there are also certain services that states have the option of covering, and there are long lists of those, of optional services. Those could include things like podiatry, optometry, potentially dental services, maybe respiratory care services, things along those lines. And of course, to be eligible for Medicaid, not only do you have to have certain income eligibility, you also must be medically needy. You must need to have Medicaid coverage for a specific condition. So if you would like to see a more detailed list as far as what the federal government requires states to cover under Medicaid, Medicaid.gov is an excellent resource. As far as mandatory benefits, you'll see things such as inpatient hospital services, nursing facility services, home health, physician services, transportation and medical care. We often see that as helpful to folks who receive Medicaid, being able to get to appointments, outpatient hospital services, the things that you would assume would be covered under Medicaid. And then there are optional benefits that states are not required by federal law to provide, but they may provide as sort of an expansion of Medicaid, so to speak. And those sorts of things, like we mentioned earlier, would be physical therapy, podiatry services, maybe dental services, eyeglasses, hospice, chiropractic type things. So as far as an exhaustive list, Medicaid.gov is a good resource for that. Okay, so let's talk a little bit about Medicaid waivers. Now, when we talk about waivers, what does that mean? It actually means that Medicaid, of course, has its requirements, But when we're talking about Medicaid waivers, we're talking about a program that allows some Medicaid requirements to be waived in order to provide alternatives to traditional service delivery. So probably the waiver that we work with the most with the Exceptional Family Member Program is the North Carolina Innovations Waiver. And that is a Medicaid waiver program for individuals with intellectual disabilities and other developmental disabilities. And it provides support to give those individuals and families more control over their lives by offering a large array of service options to the enrollees. So what does that actually mean? It means that this program, the purpose is to provide long-term care services and support to a person with disabilities in their home or community rather than an institution. So we like to use the innovations waiver, of course, so that our loved ones are able to continue to live in our homes, continue to participate in the community without having to be institutionalized. So if a person is qualified under the innovations waiver and the waiver is in fact received, then what happens is we work with a team to develop a person-centered plan of care, and that's also called an individual support plan. So what does that look like? We have to plan what our person with a disability will need as far as those community services and supports. So does this person require a community navigator? Do they need day support? Do they need is respite care going to be part of this for the family? Do they need modifications to their home or other residential type supports? Do they need supported living, help paying bills or that sort of thing? Do they need supported employment? Do they need a person that assists them with being able to go to work every day? So these are important things and important safeguards that we can use through the innovations waiver to help our people, our loved ones with disabilities to continue to live with us and to be part of the larger community without the need to have them in an institution. So as far as Medicaid waivers, for the innovations waiver that we just discussed, there are certain requirements. So the requirements are as follows. You have to meet the requirements for intermediate care facility for individuals with intellectual disabilities, that level of care, which is called ICF IID. So again, we're talking about having our person with a disability remaining in our homes and in the community without having to be institutionalized or placed into a facility, so to receive that level of care. So but they must need that level of care basically to be considered for the waiver. Also, they must live in an ICF IID, which is again the intermediate care facility, or be at risk of being placed in one. They must be able to stay safe, healthy, and well in the community while using the innovations waiver services. They must need and use the innovations waiver services listed in the person-centered plan at least once a month. And they must want to use the services instead of living in an ICF, which is the intermediate care facility. So as far as innovations waiver, it's for those individuals who would meet the requirements for commitment to a facility of some sort or would need that level of care, but we're able to keep them safe and healthy in their own home and using those community resources that we listed earlier. If you want to apply, you have to contact a local management entity, managed care organization, which is called an LME for short. And they can help you get those North Carolina Innovation Services. There's only a certain number of innovations waiver slots. I think as family caseworkers, we run into that often, where you see families who apply and then are basically waitlisted because there are no slots. If those slots are full, the name of the disabled person will be added to the registry of unmet need. So the current LME for our area is going to be Trillium Health Services. And if you go to the Trillium website, they actually have really good, very straightforward information on how to use their services and who should contact them. It talks about mobile crisis and how they're there for folks who are uninsured or may be on Medicaid or may not be on Medicaid. So the door is really open as far as contacting Trillium for services. They make it really easy. They have an 800 number. You can contact them online. And again, their website is just a plethora of wonderful information for clients or for the family caseworker needing to get information. So there are other types of Medicaid waivers as well, and those are the Continued Community Alternatives Program waivers, or CAP programs. As far as eligibility for those programs, they are, of course, Medicaid programs, home and community-based services waivers granted by the Healthcare Financing Administration, HCFA. Those CAP programs allow North Carolina to use Medicaid funds to provide home and community-based services to Medicaid recipients who require institutional care. That would be placement in a nursing facility. And that is as opposed to what we were talking about before, which is the intermediate care facility for the individuals with intellectual disabilities. So this is a different level of care and a different type of placement that would be required for the person. So when you're looking at the differences between the innovations and CAP, that's the main difference. But it's also for whom care can be provided cost effectively and safely in the community with CAP services. CAP participants must meet all eligibility requirements under Medicaid. So the two main types of North Carolina CAP waivers are CAP for children, which is CAP C. We hear about that often, and it's available to any child from birth through 20 years of age who meets both the Medicaid eligibility criteria and the CAP C eligibility criteria. So it's two different types of eligibility. We have CAP for disabled adults, which is CAP DA, and that is for adults, of course, as opposed to children with disabilities who are older than 18 and who are at risk of institutionalization. Again, the main difference would be CAP for disabled adults is more for physical type disabilities than the intellectual disabilities that are covered under the Innovations waiver, and it's a different level of support that would be needed in the community to allow that person to remain in their home as opposed to being placed into institutional care. So let's now turn our attention to supplemental security income, SSI. As we've already established in the state of North Carolina, if a person is entitled to SSI, they become automatically eligible and entitled to Medicaid in the state. But essentially what SSI is a federal income support program. It was established in 1972 that provides cash benefits to aged, blind, and disabled individuals who have limited income and resources. In many states, those individuals who are eligible for SSI are automatically eligible for medical assistance through Medicaid. If you go to the Social Security website, ssa.gov, you can look for those states where eligibility is not automatic in the event a family moves to a different state, moves around. We see that often. There are certain states where it is not automatically available, but there is, of course, a different, they can still apply for Medicaid. It's just a separate process. It's not automatic as in the state of North Carolina. So it's just an extra hoop that they would have to jump. Who is eligible for SSI? Those who are age 65 and over, a person with blindness at any age, a person with a disability at any age, and of course a person with limited income and resources. So there must be a disability and there must be income and resource eligibility. So it's a two-prong analysis when we're talking about supplemental security income. Often in the legal assistance office, we have folks come in and it was suggested to them by their doctor that they would qualify, and they don't know why they don't qualify, why they make too much money. So those are always interesting cases, because I have to remind people that it's a program that is for really the people in our society of limited means with disabilities, so that they can basically live a minimal a minimal life, basically, to provide for their very basic needs of housing, food, clothing, that sort of thing. So not everyone is entitled to it. Those income requirements are very, very important, and that's not a situation that you can generally win an appeal concerning as far as income. Usually if you're going to appeal or ask for a reconsideration, if you are denied benefits, it's because there is some discrepancy or some disagreement about the level or the type or the existence of the disability. So that's generally the legal advice that's provided. So talking about SSI coverage, we've established that there must be a disability in order to qualify, and also that there must be financial eligibility. So as far as the disability, it must be a medically determined disability, which is either physical or mental, that's expected to last for a year or longer. And sometimes that disability could ultimately result in death, of course, but the disability must significantly impact a daily living function, which is, of course, things like eating and breathing, learning, dressing, caring for oneself. The other criteria, of course, is the financial criteria that must be met in order to qualify. And if the person is actually working, if they're able to physically work a job, they have to earn less than $796 a month. So as you can see, Social Security really is just a bare minimum cover for those folks who really don't have the resources to live above the poverty line per month. Also, if we're applying for a child for SSI, of course, their parents' income is considered. So, of course, most children under the age of 18 with a disability are not going to have any sort of income, but their parents' income is, in fact, considered. After the age of 18, the child who is now a disabled adult, it's a different sort of calculation. But as long as they're under 18 and living in their parents' home, that parent's income is considered. The Social Security also limits assets to $2,000, and I'll talk a little bit more about that in a second. And there are other assets that are allowed by Social Security Administration. So as far as things that are counted as resources, because you have to stay below a certain amount of resources, and we've established that that's $2,000 in order to qualify for SSI. So if you're looking at what counts as a resource, we would be talking about cash on hand, types of cash that would be in your wallet, or maybe something you've stocked away in a box somewhere. Any type of money you have in a checking or savings account. If you have a life insurance policy that has a cash value over $1,500, that is actually considered. Stocks and bonds are considered. If you have more than one motor vehicle, that second motor vehicle is considered. And of course, if you have real estate other than the home that you live in, that is considered an asset. So things that you would think of as assets and money that would be considered by the Social Security Administration for eligibility are counted as resources. So resources that are not counted, the Social Security Administration has 44 different exclusions. You can find that on the Social Security website at ssa.gov. But mainly the home that you live in is not considered. The value of that doesn't matter. The vehicle that you have that you use on a daily basis is not considered as long as it's just one vehicle. Household goods and personal effects aren't considered. And ABLE accounts, if you have an ABLE account, you can have up to $100,000 in there that's not considered. And of course, assets that you might place into a special needs trust, those are not considered by the Social Security Administration to be assets.
All right, so we just listened to Vicki talk about a lot of information, and she also shared some resources with you throughout her segment of this brief. So kind of want to show you what those look like. So if you find yourself in need of some information, you can Google what you're looking for and kind of find and make sure you're on the right spot. So here is Trillium Health Resources. So for Eastern North Carolina, basically the whole eastern part of the state, Trillium is the LME or MCO for this area. We were talking specifically about the innovations waiver. So typically all websites have a little search function. Type in the word waiver. Innovations waiver is just littered throughout here, and you could look for applications. You can renew, read some articles about it, but this is typically where you would find information about the Trillium Health Resources Innovations waiver. So also for individuals and families, you get, click on these links and it will take you to a lot of great information. We got a handbook here, benefits plan. So just know that this organization's here to help those individuals with some intellectual developmental disabilities and substance abuse disorders for Eastern North Carolina. Oh, moving back, let me go home again. Typically, most of these websites have something down at the bottom of their homepage that allows you to register for a newsletter. So if you don't want to go hunting for information, you can just go to this website, sign up for the newsletter, and then they'll email you frequently with news and updates. So here's the Department of Social Services, and this is for North Carolina, the main page, and this is where you would find information about Medicaid and how to apply for it, and this is the state's perspective, state level information. But again, a lot of links. You're on the right page here if you see .gov at the end of the website. So we talked about Medicaid and the Trillium Health Resources, and we also talked about CAP-C. So this is, again, has the .gov, but more information about CAP-C programs and qualifications, and just, again, a lot of information. You can click through here at your leisure. And then we talked about CAP-DA. And this is what that website looks like. Again, a lot of information for you to consume and absorb here. So here is the North Carolina, Onslow County Health and Human Services, where you would go to actually apply for these Medicaid and CAP-A and CAP-C programs. So you would Google Onslow County Public Health Consolidated Human Services, and you'd be able to find information about how to apply for these benefits locally. Then you heard Vicki mention the SSA.gov website. Simple to remember, SSA.gov. And you have a segment here about disability benefits. Again, all these hyperlinks are available for you to explore and learn more about what's available through Social Security. The local office for Eastern North Carolina, this region, is located in New Bern. And New Bern is approximately 45 minutes from here. All right. So that's just a brief review of all of the websites that Vicki was just chatting about. Again, we look forward to helping you out. Should you have any comments, questions, or concerns, give your family caseworker a call. Thanks. All right, so that's all we have for you guys. If you have any questions, please feel free to give us a call at either our Camp Lejeune or New River office, and you can always find Ms. Vicki O'Brien's contact information on our website. We look forward to hearing from you. Take care.